Edema is characterized by swelling due to an excessive accumulation of tissue fluid within the interstitium and intracellular spaces. We can have generalized edema or local edema. It's the consequence of venous stasis or lymphatic stasis, as happens in the case of lymphedema. When the normal lymphatic flow is obstructed, the liquid accumulates, causing the typical lymphedema swelling, a chronic disease with an evolutionary, disabling, and worsening nature. Lymphedema is a form of edema with a high concentration of interstitial protein, albumins, and free iron. Proteins stagnating in the interstitial matrix attract water molecules and stimulate fibroblasts at a local level to produce collagen fibers and fibrosclerotic tissue. Experimental and clinical evidence show that the non-negligible factors in the process of lymphedema are the hyperaccumulation of iron, the increase of free radicals, tissue acidity, the alteration of metalloproteases in the tissues, and the reduction of oxygen. Without proper management, lymphedema can cause serious complications, infections, pain, reduced mobility. It has a significant impact on the quality of life of people affected by this disease. Manual lymphatic drainage has to precede other treatments. It is not useful considered alone. We can have pressotherapy, elastic compressive bandage, and also Godoy method. Cupping is not recommended for people with diseases of any kind. Looking at the current therapeutic aids, we realized that a follow-up was necessary and a new element had to be added to the treatment of lymphedema, Vasopure, a lotion with chelating and proteolytic action. Vasopure is based on apolactoferrin in liposomes and MSM. It reduces the iron accumulation, prepares the skin for manual drainage, and softens the parts affected by fibrotic accumulation. The toxicity of iron is due to its oxidizing action. Free iron reacts with oxygen and peroxides, producing free radicals that are dangerous for the cell structure. Lactoferrin is a natural glycoprotein that acts as a natural chelator of iron. Its ability to bind iron is 5 times higher than transferrin. The insertion in liposomes significantly increases lactoferrin concentration in the skin tissue and guarantees a greater penetration at the dermal level. Lactoferrin can bind albumin, which has a high concentration in interstitial fluid. When albumin forms a complex with lactoferrin, it is no more able to recall water, so that the typical swelling is reduced. The results of an electrophoretic separation show that lactoferrin can bind the albumin, causing the saturation of the binding sites of albumin. MSM is the active and non-toxic metabolite of DMSO. We exploit this protein denaturing action in hydrophilic proteins. Due to the studies carried out, we know that the use of apolactoferrin liposomes with MSM improves the negative effect caused by edema, especially in the treatment of lymphedema. Elastasonography is an ultrasound technique useful to obtain pieces of information about the hardness and elasticity of soft tissues or nodules. It underlines elasticity changes of the structure under analysis on a chromatic scale. The ultrasound probe is used and a vertical compression to the tissues is applied. This is a Biobasic Europe study from 2019, where the goal was to evaluate Vasopure effect in reducing the imperfection of cellulitis and localized adiposity. Based on the results obtained, we can say that Vasopure reduces skin imperfection caused by cellulitis and localized adiposity. Thank you.